The top stories tonight in Y News. The Philippine Health Insurance Corporation suspends its scheduled increase of contribution until Congress passes a law allowing the deferment of the scheduled adjustment.
Several Metro Manila residents are hesitant to receive the government's approved COVID-19 vaccine.
The National Bureau of Investigation to reach out to civic leader Teresita Angsi over reported vaccination of Chinese nationals in the country.
And family of slain flight attendant Christine Angelica Dacera cries for justice, calling suspects and other persons of interest to turn themselves into authorities.
Good evening, Philippines and the world. Today is Tuesday, January 5, 2020. Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I am William Pio.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through UNTV News and Rescue, social media accounts, and our website, untvweb.com. I'm Angelo Castro III.
First in the news, good news to PhilHealth members. The state health insurance will not proceed with a scheduled increase of contribution for members. Lawmakers, meanwhile, from the House of Representatives have taken the step towards deferring the said increase. Ray Pelayo tells us why.
The Philippine Health Insurance Corporation, or PhilHealth, temporarily suspends the collection of the premium rate hike scheduled to be implemented this month. PhilHealth President and CEO Attorney Dante Giran said in a statement that this is in response to the call of President Rodrigo Duterte to ease the burden of Filipinos still reeling the effects of the pandemic. Giran noted that this interim arrangement will be good until the Congress is able to pass a new law allowing the deferment of the scheduled premium adjustment in the Universal Health Care Act of 2019. And if the Congress did not act on the matter, PhilHealth will implement the scheduled premium adjustment.
Kami umaasa na hindi naman yan magtatagal sa Kongreso. Nakita naman natin na ang mababang kapulungan at ang Senado ay kahit sila ay sumusuporta po sa panawagan ng Pangulong Duterte.
The state health insurer is also hoping that the measures will also be approved to help its operation.
Kami naman umaasa ng suporta mula sa ating Pangulo at sa iba't ibang mga ahensya ng pamahalaan para po maibigay sa PhilHealth yung kinakailangang funding na dapat ma-generate itong premium adjustment.
Meanwhile, resolutions and bills are already filed in the House of Representatives to defer the premium rate increase of PhilHealth. House Speaker Alan Velasco said that they are ready to review the Universal Health Care Act, particularly the provisions on the incremental premium rate hike. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Social Security System, or SSS, meanwhile reiterates the importance of this year's contribution hike, saying that this will benefit their members. But the social insurance is willing to defer their increase if President Rodrigo Duterte asks them to do so. Joanne Nano tells us why live. Joanne?
Yes, Jago, following President Duterte's order to defer the implementation of additional contribution of PhilHealth, the Social Security System said that they are also willing to do the same thing if President wants them to do so, and amendments of the Social Security law should be done. SSS President and Chief Executive Officer Aurora Ignacio gave the assurance when asked if they will be deferring the contribution hike if the President told them to do the same thing. Here's the statement of SSS President and CEO Aurora Ignacio.
Marami ho naman talaga kaming nakaplano na ibigay na benefits ngayon, pati yung projected contribution. Pero kung iyan po ay isa sa batas or imamandato po sa amin ng palasyo at ng presidente, kami po ay susunod.
Jago, the official again reiterates that the implementation of the contribution hike will be beneficial as they will be able to provide the corresponding claims and benefits that should be given to their members. SSS argued that although they understand that most of their members were in crises brought by the COVID-19 pandemic, they have no choice but to implement the law in order to sustain their programs. Once again, here's Ms. Aurora Ignacio, the President and CEO of SSS.
Dami din po naman ang nawalan ng trabaho or nagkaroon ng businesses na nagbawas ng tao. So, kung ito po, apektado din po ang SSS na nabawasan po ang contribution na natatanggap namin. Pero yun po kasing benefits ay hindi po nababawasan. Ito po ay lalo pang nadadagdagan dahil kailangan po ito ng mga miyembro natin. Kaya karamihan po sa kanila ay nag-a-avail ng benefits natin ngayon. Lalo na po yung mga calamity loan na binigay natin last 2020.
From the previous 12%, SSS has increased their members' monthly contribution to 13%. This is to ensure the long-term viability of the pension fund and increase the benefits enjoyed by beneficiaries. On the other hand, Jago, President Duterte is yet to decide if he is also in favor to defer the contribution hike of the state-run social insurance program. And that is the latest live. Back to you, Jago.
Thank you, Joan Nano, reporting live.
Meanwhile, COVID-19 vaccines in the country, there are still several residents in Metro Manila who are hesitant to get vaccinated with a government-approved vaccine. Our health reporter, Aiko Miguel, asked them why.
10 residents in different parts of Metro Manila were asked by our team whether they are willing to receive the government's COVID-19 vaccine once it gets approval from the FDA, but none of them agreed to get vaccinated. It also appeared that they are not yet well informed about the government's plan and even about the COVID-19 vaccines.
Naririnig ko yung bakuna na meron na raw pero wala pa naman ako narinig na meron ng binakunahan eh.
Para sa akin, ayoko pa magpapakuna kasi hindi pa ako sure kung ano yung epekto nito sa katawan natin eh. Hindi ko pa naintindihan kung anong klaseng mga bakuna itatasa sa atin.
Dialysis patient ako. Susubukan muna sa iba.
The respondents' age ranged from 21 to 57 years old. 2 of the respondents said they lack trust on the COVID-19 vaccination plan of the government, especially that there was a controversial issue on Dengvaxia vaccines before.
Our president is not even having like a clear answer about it. Why would I go for it? Ngayon nga, nagkakagulo sila sa gamot. Paano pang mga tao maniniwala sa kanila? Depende po kung 100% na sure yan, na hindi kagaya sa Dengvaxia noon.
On the other hand, 2 respondents would consider to receive COVID-19 vaccines if they are approved by authorities and undergo the regulatory process of the Food and Drug Administration.
Hindi po. Kailangan po siguro aprobado po muna ng FDA siguro bago po magpabakuna.
Kagaya ngayon, maraming issue na about sa bakuna, maraming side effects. Depende siguro kung okay naman sa iba, why not? Pagpapa-injection naman ako sakali. Ako aprobado naman, okay naman.
The UP Octa Research also conducted a survey to 600 respondents in the National Capital Region last December. Their survey resulted that 25% or 1 out of 4 respondents in Metro Manila wants to be immunized with COVID-19 vaccines. Majority of respondents are uncertain, while 28% doesn't want to be vaccinated against COVID-19. According to Dr. Guido David of the UP Octa Research, the government should strengthen the information drive on the vaccination plan to get the public's trust on the program and even on the efficacy of vaccines.
We have to remind people now, if we want to go back to having the old economy, hindi pwede yung bahala na or okay lang, magkasakit. I mean, it's not like that. We have to. What we're doing is we're also protecting the frontliners. We're protecting the elderly. We're protecting those with pre-existing conditions. So we have to protect them, and that's why if we want the economy to open, we need to be vaccinated.
Issues and criticisms are arising on the unauthorized COVID-19 vaccination of some members of the Presidential Security Group. But the DOH and FDA assures that all potential COVID-19 vaccines that will be used in the country will undergo process, and all those who are in the priority list of the government will first receive approved COVID-19 vaccines.
we can assure the local governments that based on the prioritization list, kasama po kayo lahat dito sa ating mga listahan based dun sa mga priorities na na-spell out or naging officially declared na.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Philippines recorded 937 new cases of coronavirus disease or COVID-19 today, bringing the nationwide count to 479,693. The Department of Health also reported 114 new recovered patients, pushing the total recoveries to 448,375. 58 fatalities were recorded, taking the death toll to 9,321. According to the latest case bulletin, Davao City contributed the highest number of new cases with 85, followed by Isabela with 54, Agusan del Sur with 49, Pampanga with 48, and Misamis Occidental with 43. Active cases are at 21,997. Of this, the department said 81.4% are mild cases, 8.5% are asymptomatic, 6.2% are in critical condition, and 3.3% are severe cases, and 0.55% are moderate cases.
England will soon face a tough lockdown period, with the new coronavirus variant aggressively infecting its citizens and now reaching the highest alert level. Early Briones will tell us why.
United Kingdom Prime Minister Boris Johnson announces a newer and tougher nationwide lockdown for England as the COVID-19 epidemic now reaches alert level 5 in the country. The current surge of cases is said to be connected to the spreading of the new, highly contagious variant of the virus. This Wednesday, Prime Minister Johnson will immediately begin implementing strict stay-at-home restrictions, with individuals only allowed to step out of their homes to go essential shopping, exercise, complete swab tests, seek medical help, and escape domestic abuse. Non-essential retail, hospitality, and personal care services will all be closed. Schools and colleges will once again switch to online learning, but support and childcare centers will remain open for those legally permitted. Workers unavailable to work from home are also exempted. The restrictions are set to last until mid-February, a point where the government will aim to have vaccinated those at highest risk and most vulnerable, and with expectations that healthcare services will be in a more stable state.
And of course, that will eventually enable us to lift many of the restrictions we have endured for so long. I must emphasize that even if we achieve this goal, there remains a time lag of 2 to 3 weeks from getting a jab to receiving immunity, and there will be a further time lag before the pressure on the NHS is lifted. So we should remain cautious about the timetable ahead.
The measures only apply to England. However, the other 3 countries of UK, Scotland, Northern Ireland, and Wales will be implementing their own rules. The Prime Minister states that the country will enter the toughest and hardest phase yet of the battle against COVID-19 ever since its last lockdown on March, as healthcare services now become increasingly at risk of being overwhelmed. He remains hopeful, however, that the struggle will ease faster if the citizens work together in helping the infection rates drop. Early Briones, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notification. You may also follow us on Facebook.
The Armed Forces of the Philippines withdrew the investigation on the Presidential Security Group's use of unregistered COVID-19 vaccine. The said fact-finding investigation was scheduled to begin today. Joan Nano tells us why.
The Armed Forces of the Philippines did not proceed with their fact-finding investigation against some members of the Presidential Security Group. This is in relation with the controversial inoculation of registered COVID-19 vaccines by some members of the PSG. The AFP has called off their investigation following President Rodrigo Duterte's statement saying that he will not allow the PSG to attend the congressional hearing or rather shut up and invoke the right against self-incrimination. AFP spokesperson Major General Edgar Arevalo explains that since the President as their Commander-in-Chief have spoken and sent out this clear message, they will not push through with their investigation.
Base sa statement na ipinalabas ng ating Pangulo, ang ating Commander-in-Chief, bago maghating kagabi, ay nagdesisyon po siya na i-call off na itong investigation na ito sapagkat malinaw ng kung sinasabi ng ating Pangulo na wala nang pangailangan, na hindi na niya pinapayuhan na dumalo sa investigasyon ang miyembro ng Presidential Security Group, and they will invoke, if ever summoned and they would appear, they would have to invoke their right to remain silent.
During his press conference last night, President Duterte again defended the PSG over the controversy and said that they only did it for his safety.
To me, it's a matter of self-preservation. Yan lang. Whatever be your objection, whatever be your criticism, para sa akin, it is a matter of preservation. And I would like to call on Congress na hindi naman ako nakikiusap. Ang ano ko lang, diretso na salita na do not tinker with the PSG.
On the other hand, the Food and Drug Administration explains to the President that they may issue a special permit to a small group like in the case of the PSG if they wanted to get vaccinated even in the absence of an emergency use authorization or EUA.
For if it's going to be a smaller group po, for example po yung PSG, and of course priority naman po talaga nila na kayo ay protectionan, then we can give po compassionate special permit for this. Kasi maliit lang naman po yun, and then a hospital can take care of it.
Just yesterday, the AFP announced that they will conduct a thorough investigation against the controversial unregistered COVID-19 vaccination of several members of the PSG and vowed to be transparent with their findings. Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, presidential spokesperson Harry Roque advises President Duterte's close-in security team that they should consider applying for a special permit on the use of coronavirus vaccines before local regulators. Rosalie Cos will tell us why.
Malacanang insists that it is within the discretion of the executive branch agencies such as the NBI and FDA to push through with their investigations of some members of the Presidential Security Group into their use of an unregistered COVID-19 vaccine. This after President Rodrigo Duterte barred the PSG from attending the Senate inquiry regarding the issue. According to presidential spokesperson Harry Roque, the president has no directive to the PSG not to cooperate with the said executive agencies. Today, the Armed Forces of the Philippines had announced it canceled its plan to investigate the PSG personnel on the smuggled COVID-19 vaccines.
Yung mga hearings ng ehekutibo can continue, and of course we expect the PSG to appear and cooperate. There is no order from the President not to participate.
Meanwhile, the palace advises the PSG personnel to submit an application for a special permit before the Food and Drug Administration on the use of experimental vaccines. Yesterday, FDA Director General Eric Domingo said they can issue a compassionate special permit for a small group of people, such as the PSG, due to their mandate to protect the president.
I would seriously advise PSG na sundin yung sinabi ni Yusek Domingo, mag-apply ng special permit nang sa ganun maturukan yung lahat ng miyembro ng PSG.
Meanwhile, the palace also defended the president last night about his statements that he did not know what vaccine was administered to his close-in security personnel and he was not sure if they were indeed vaccinated. According to Secretary Roque, the PSG did not ask permission to the president before the vaccination.
Ang alam lang niya after the fact na nagpaturok na sila. Pero hindi po nagpaalam, hindi nagbigay ng consent. Nabalitaan na niya na maraming nagpaturok, kaya sabi niya, say la vie, kung gusto nilang gawin yon para sa kanilang buhay at para magawa ang katungkulan nila, decision nila yon.
Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
The National Bureau of Investigation said it would reach out to civic leader Teresita Ang Si as the agency hopes to collect more information on reports that thousands of Chinese nationals in the country have already been vaccinated against COVID-19. Dante Amento tells us why.
Civic leader Teresita Ang Si had disclosed that 100,000 Chinese nationals, particularly Philippine offshore gaming operator or POGO workers, were inoculated by COVID-19 vaccines. Ang Si added that there is nothing wrong with it.
Siguro starting November, marami ng mga Chinese nationals ang nagpapabakuna. So I'm glad that they are being vaccinated because it protects us also if they are protected.
But the civic leader said she had no idea on how the vaccines were able to enter the country.
I do not know how these vaccines came in. Very early, marami na nagpapa-reserve at sabi vaccination will start in December. Maybe it's one of the things that our Department of Health should study. If it is coming in, it is only for Chinese nationals, so be it.
Meanwhile, the National Bureau of Investigation or NBI will push through with its investigation on the Presidential Security Group's use of unauthorized COVID-19 vaccines.
As far as the NBI is concerned, that order has not been recalled, that order has not been withdrawn. There is no order as of this time from the Secretary na sinasabing wag ituloy ng NBI. That will continue.
The NBI sees no conflict with President Duterte's pronouncement barring the Presidential Security Group to speak if they will be summoned by the Congress for the investigation. NBI spokesperson Attorney Ferdinand Lavin says it was not intended for them and their investigation is not focused on the PSG vaccination alone. It is for all the reported importation, sale, administration, distribution of unregistered vaccines. In fact, civic leader Teresita Ang Si will be invited by the NBI to gather more information about the information she had disclosed. The NBI wants to know who are the people behind the mass vaccination of Chinese nationals.
Reach out to her. Maybe invite her for some info. Kasi hindi naman ito sa PSG lang. Lahat ito na nagkaroon ng vaccination.
Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Senate will not invite the members of the Presidential Security Group following President Duterte's warning to Congress of a potential crisis. Meanwhile, one senator believes what the president did is wrong. Harleen Delgado tells us why.
Despite warnings from President Duterte, the Senate will continue its hearing on the COVID-19 vaccination plan of the government next week. However, Senate President Vicente Soto III, who chairs the Senate Committee of the Whole, clarified that the Presidential Security Group will not be invited in the hearing. According to Soto, the president must have been misinformed, noting that the topic of the hearing will be the government's plan for the 72.5 billion pesos allocated in the 2021 national budget for the COVID-19 vaccine rollout and not the issue on the PSG's unauthorized use of vaccine from China. While the president can invoke his executive privilege to prevent his close-in security not to attend hearings, Senate Minority Leader Franklin Drilon said that it should not stop Congress from performing its duty and power to investigate matters in aid of legislation. Drilon insists that the hearing must continue and investigate the entry and use of illegal and unauthorized COVID-19 vaccines in the country following reports that there were allegedly 100,000 POGO workers who were inoculated already. Senator Richard Gordon, meanwhile, believes the president should respect the separation of powers, with Senate being a co-equal branch of the government. According to Gordon, he commends the loyalty of the PSG to the president, but emphasized that no one is above the law.
Well, that's unfortunate because I think he's wrong. The president has got to respect the separation of powers clause. To shackle the Senate or the Congress into not doing what it's supposed to do I think is a wrong thing to do by the president.
Despite this, the lawmaker still wants to know who supplied the unauthorized vaccines to the Philippines and how did it enter the country. Gordon is willing to conduct a separate hearing under his Blue Ribbon Committee regarding the issue.
Bakit tinatago? Is somebody laying the predicate here for Chinese medicine to be pushed? Because lumabas na ngayon, 200 Chinese na na-inoculate.
For Senator Francis Pangilinan, it would up to the senators whether or not to shed light on the PSG issue. However, it is the Senate's responsibility to act as check and balance and try to address the irregularities of those in the executive branch. Senator Risa Hontiveros also echoed the call to investigate the alleged vaccination of hundreds of thousands of POGO workers in the country. The Senate Committee of the Whole has yet to release the final list of resource persons who will attend on the hearing to be held on Monday. Horadine Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notifications. You may also follow us on Facebook.
And for the news abroad, Alibaba founder Jack Ma's absence from public view in the past 2 months, including the missing final episode of a TV show on which he was to appear as a judge, has fueled social media speculation over his whereabouts amid a Chinese regulatory clampdown on his sprawling business empire. China's highest profile entrepreneur has not appeared in public setting since a late October forum in Shanghai, where he blasted China's regulatory system in a speech that put him on a collision course with officials, resulting in the suspension of a $37 billion IPO of Alibaba's Ant Group fintech arm. While news coverage of Ma's absence from public view triggered speculation on Twitter, which is blocked in China, it was not a significant trending topic on social media in mainland China, where sensitive topics are subject to censorship. Chinese regulators have zeroed in on Ma's businesses since his October speech, including launching an antitrust probe into Alibaba and ordering Ant to separate its lending business from its online payments division. South Korea has experienced continuous decline in birth rate, causing the country to report more deaths than births. Nina Bascon will tell us why.
For the first time in South Korea's history, the country recorded 275,815 births compared to 307,764 deaths in 2020, based on the latest census data released by the Ministry of Interior and Safety yesterday. Based on last year's report, South Korea's death rate has increased by 3.1% in 2020, although the report did not mention that the increase in deaths was driven by the pandemic. The country has reported 1,007 COVID-19 fatalities according to Johns Hopkins Center for Systems Science and Engineering dashboard. The census further revealed that almost 1/3 of South Korea's population is in the age bracket of 40s and 50s, while nearly a quarter of the population is at the age of 60 and above. Korean experts have warned that the pandemic could possibly contribute to a continuous decline in births, as couples will be more cautious of having more children because of the financial and economic reasons. The Central Bank of Korea says that the falling birth rates and aging population of the country could even accelerate, given the job insecurities for young adults, which could delay their plans of starting a family, while the other family units may experience personal anxiety, which could also lead to postponement of births. A growing trend of delaying or avoiding marriage is seen in the country, where people aged between 20 to 44 years old remain single, according to the report shared by Korea Institute for Health and Social Affairs. In a statement posted on Facebook by Deputy Prime Minister for Economy Hong Nam-ki, he acknowledged that the country's demographics is at critical front and working population continue to decline. To address the ongoing issue, the South Korean government has released some incentives to its working population, such as reducing the maximum number of working hours from 68 hours a week to 52 hours a week. This is still 14 hours longer if compared to other countries such as Australia. The government also released its fourth basic plan for low fertility and aging society, which covers the country's population policy, as well as providing cash incentives of 2 million won or $1,826. The government also released its so-called first-year subsidy, where parents of newborns will be paid 300,000 won or $270 per month until the child reaches 1 year of age. This is on top of the 100,000 won given to children aged 7 years and younger, while couples are expected to receive 3 million won or $2,700 monthly during their 3-month parental leave. The government will supply 27,500 houses exclusively for families with 2 or more children by 2025. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
UK scientists warn that the South African COVID-19 variant may be resistant to vaccines and more difficult to pick up through testing. Marvy Delphine will give us the details live. Marvy?
Steph, as the UK began its rollout of the Oxford-AstraZeneca vaccine after starting to deploy the Pfizer-BioNTech shot in December, scientists are particularly concerned that the new South African COVID-19 variant could be resistant to the COVID-19 vaccines approved or still waiting approval in the US and Europe. British Health Secretary Matt Hancock has then called for the immediate closure of borders amid fears that the new, more transmissible South African variant poses even more of a risk than the B117 variant discovered several weeks ago in Britain. Dr. John Bell of Oxford University, who advises the UK government's vaccine task force, said that the vaccines would work on the British variant, but added that there was a big question mark as to whether they would work on the South African variant. According to scientists, both the South African and UK variants are associated with a higher viral load. This means there is a greater concentration of virus particles in patients' bodies, possibly contributing to increased transmission. But Dr. Simon Clark, an associate professor in cellular microbiology at the University of Reading, said that while both variants were similar, the one identified in South Africa has more additional mutations. The South African variant carries 2 mutations at key areas of the gene, which builds the spike protein, a projecting arm that the virus uses to attach to human cells. Dr. Clark highlighted that any significant changes to the spike protein may mean the body cannot spot the virus even after vaccination or a previous infection. Worryingly, these changes may make it harder to pick up cases through PCR testing. There were also fears that people who have had the virus may not be protected from the new COVID-19 variant. The South African variant has spread internationally and has caused an alarming spike in cases, hospital admissions, and deaths in both Britain and South Africa. The UK has now recorded over 2.6 million COVID-19 cases and over 75,000 deaths to date, while in South Africa, over 1.1 million cases have been recorded and almost 30,000 deaths. Scientists said that further restrictions must be brought in to prevent the further spread of the virus and avoid overloading the health system. Steph?
All right, Marvy, thank you for that live report. The Civil Aviation Authority of Thailand imposed new guidelines, particularly on banning specific items on domestic flights. From Thailand, Charisse Lomboan reports to us live. Charisse?
Steph, effective December 31st, food, drinks, and printed materials, except those concerning safety, are now banned by the Civil Aviation Authority of Thailand, or CAAT, for domestic flight operations in Thailand. According to Director General to CAAT Chula Sukmanok, reading materials can cause exposure to virus as these cannot be cleaned thoroughly due to short cleaning time for each stop of domestic flight. And with the strict implementation of wearing masks on board, passengers are not allowed to eat or drink except in case of emergency or necessity. But the passenger has to be brought in an isolated area away from other passengers. Meanwhile, Thailand's Ministry of Public Health will request the Center for COVID-19 Situation Administration or CCSA to suspend the flights from United Kingdom as 4 British nationals entering Thailand last December 21 were confirmed to have the B117 strain of COVID-19. Steph?
Thank you, Charisse, for that report. And those are the reasons behind the news in the other parts of the globe. Live from Hong Kong, I'm Stephanie C. For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notification. You may also follow us on Facebook.
Back to our headline stories in the country. The mother of flight attendant Christine Dacera, 23, who was found dead in a Makati hotel, is seeking justice for her daughter. Meanwhile, a suspect in the brutal murder has finally broken his silence regarding the serious accusations thrown against him. Lea Ilagan explains why.
The mother of flight attendant Christine Angelica Dacera, who was found dead in a room after a year-end party, appeals to President Duterte to help them attain justice for the death of her daughter. According to Sharon Dacera, it is hard for their family to accept that her daughter is gone and had experienced a brutal death.
Tatay Digong, Tatay Digong, tulungan mo kami. Ordinaryo lang po ako na tao. Ordinaryo lang po yung pamilya ko.
Mrs. Dacera also asked help from the presidential daughter, Mayor Sara Duterte Carpio. She said she will fight for Christine and she would not allow other women to experience the same thing.
I don't want that somebody will be victim again with this kind of brutality. Barbaric, binamon niyo anak ko. Ayokong may mangyari ulit yan na isang babae na bababuyin niyo ulit.
Meanwhile, Attorney Brick Reyes, legal counsel of the Dacera family, said they are still looking for the 7 more suspects who occupying beside Christine's room at the City Garden Grand Hotel in Makati. They are still waiting for the PNP investigation to identify the 7 suspects.
There is another room, room 2207, which was occupied purportedly by about 7 other males who we have not identified up to this time. So this investigation will continue.
Reyes said Christine was drugged and abused before she was found unconscious and was declared dead on arrival in the hospital. Meanwhile, a suspect breaks his silence after being accused of the crime. In a posted message in his Instagram account, Valentin Rosales called the accusation as absurd and fake and hopes that the truth will prevail. Lea Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The Department of Tourism asked the City Garden Grand Hotel in Makati to explain why its government accreditation should not be suspended or revoked for possible violations for continuing to accept guests for leisure purposes when it is being used as a quarantine facility. In a letter dated January 5, 2021, the DOT directed the hotel management to explain why it is still taking guests when government regulations state that an establishment being used as a quarantine or isolation facility are not allowed to provide accommodation for leisure purposes. The hotel is the same establishment where flight attendant Christine Angelica Dacera was found dead. The department said the hotel must submit its written explanation within 3 days.
And those are the reasons behind the news, January 5, 2021. Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.